with us. We have Dr. Larry Eisenstein, our Commissioner of Health. We have from the Health Department, Debbie Kimmelstein, who is the Director of Communicable Disease Control, and Ann DeSimone, who is Director of Emergency Preparedness. And this staff, this wonderful staff at the Health Department, is ready and has been ready and has seen a lot over the past decades. And so we've got a very, very good operation at our Health Department. From the Nassau University Medical Center, we have Dr. Ting and Dr. Barrios joining us. And we also have our Office of Asian Affairs Director, Farah Mazawala. And if I'm missing anybody, I think we're good. Angela, you don't need to say all that, right? You're good? Okay, great. And we also have with us, so that we can make sure we're communicating with everyone, we have Milneck Interpretive Services. So thank you very much for being here. So we are all here at NUMIC today to give you a briefing on the emerging coronavirus. This morning, we just heard of a confirmed case in Chicago, according to the CDC.
大家好，今天早上纳苏军的军长 Laura Kern 和大家呢是想对新进展的武汉肺炎做一个发表会。
We understand people are concerned, but we are urging everyone to stay calm as the risk to Nassau County is low at this time.
我们呢理解大家公众对新的这个疾病的一些担忧，可是我们必须声明到现在在纳苏军的病的感染的程度呢是比较威胁较低。
As always, we urge everyone to practice good hygiene and sanitary procedures. We all know the basics. We've been through this before. Wash your hands with soap and water. Use hand sanitizer when you can't do that. Cover your mouth or your nose and your nose when you sneeze. Stay home from school, stay home from work when you are feeling sick.
目前我们建议所有的公众呢做基本的卫生的一些准备。如果感觉有病情的话呢，请待在家里，不要外出。洗手的时候呢，最好要用肥皂洗至少20秒钟。然后如果没有干净水源，请用酒精吸毒消毒液。
And if you're not feeling well, please also stay away from immune-compromised individuals.
如果您身体不是很好的话呢，请远离有并发症的患者。
Our Nassau County Department of Health is working very closely with the State Health Department and with the federal CDC, Center for Disease Control.
目前我们的卫生局现在正在与州内和联邦政府的卫生局一块观察病情的进展。
We have boots on the ground and we're monitoring the situation very closely and are ready to respond to any cases should they emerge.
我们现在非常仔细地关注病情的进展，然后如果有任何新的病例，我们已经做出了相关的应对准备。
Our medical professionals here today from the hospital and from the Nassau County Department of Health will have more detail on the procedures. But for more information and information as it emerges, please visit the Center for Disease Control's website at www.cdc.gov. And I will let Angela interpret what I just said, and then I'll turn it over to Dr. Larry Eisenstein.
我们的医疗人员呢，今天呢会给更多的措施的一些详细的了解。不过，如果想了解更多呢，请看我们的疾病控制中心 www.cdc.gov 网站了解更多。
I just want to give a special thanks to the hospital for allowing us to have this press conference here and for all the wonderful work that they do for our communities every day, whether there's an emergency or not. So thank you, NUMC. And with that, over to Dr. Larry.
Thank you, County Executive Curran. Thank you to the hospital for hosting us. And this is an example of why you have a wonderful health department. Our health department is prepared and ready for any emerging infectious disease. And we have the experience of having prepared for and worked through other newly emerged diseases such as Ebola, Zika, MARS, SARS, MERS. Our experts are going to talk to you about the steps that we take to protect the public, but the very first thing, and perhaps the most important thing, there are no cases in Nassau County right now. Nassau County communities are safe and free from coronavirus as of now. We are in contact with the New York State Department of Health and the CDC. We are very appreciative of the efforts and guidance that are coming down. We are aware that there are a lot of travelers that come from all around the world. And places like our colleges and universities are preparing for a new semester of students, many of whom come from foreign places. Guidance came down from the state just short hour ago to them, and we're in contact with our college and university partners. We're in touch with our hospital providers and our healthcare providers. The procedures to be followed in case a traveler meets criteria for testing will be clear and present. They can be found on the CDC's website, and our experts are certainly here to guide any provider that needs guidance. I think that it's important that we know that most of the time when I stand in front of you with County Executive Curran to talk about a communicable disease, we can talk about the incubation period and the rates of mortality or other illness components of this. This is brand new. And so new information is coming out literally sometimes more than daily. The CDC website gets updated when they have new information. We don't know answers to questions like, what is the incubation period and what is the rate of transmission? So we're working around the clock to stay on top of information, and as we get new information, we'll share it with you. But there are measures that anybody can take to avoid respiratory viruses. And I think we should, in the middle of flu season, which is another respiratory virus, and I take every opportunity to remind people, there is a respiratory virus in our community, and that's the flu. Hand washing saves lives. Sanitary gels work great against most coronaviruses. I can't say for sure, it hasn't been studied on the new coronavirus that we're talking about, but I have no reason to think it won't work. Please, if you're sick, stay home. That's one of the most important preventive measures in public health, is to prevent exposure. And we do know that there are criteria that the state and CDC are using to determine if a recent traveler or somebody exposed to a recent traveler should be tested. Testing is taking place across the state when people who are appropriately exposed. The determination to do that is through the state and the CDC, and they should hopefully be coming out with more information on that later. And with that, I will turn it over to our Director of Communicable Disease Control, Debbie Kimmelstein, who has been at the helm of numerous communicable disease outbreaks, and we'll talk about surveillance that occurs at the Nassau County Department of Health. Debbie?
Hi, thank you. Yes, we do a lot of surveillance for outbreak control,